So, another vlog. Again, my name is Dr. Adrian Dane Kenny. I'm the owner of Jamway Hospital and Services, which is a part of Jamway Conglomerate, and a graduate of Harvard Medical School. And I had started my internship in internal medicine at Yale New Haven Hospital down in Connecticut. The point of this vlog today is just to talk about the difference between clean and antiseptic. I'm pretty sure there are a lot of people who struggle with understanding the difference. And really, the goal is to be clean for the most part. Dirty is still healthy on some level. It's really infection that we don't want for the most part, because even infection is helpful at certain points in development and in life. It's natural, but we don't want serious infections such as abscesses or sepsis or other serious infections. So that's why being clean can be very helpful, and knowing what clean is very helpful. But being antiseptic, which is a high level, or really a level of too clean for most people and in almost most or all situations, is also not healthy, which really happens with antisepsis. So let me just explain the difference very clearly and concisely and specifically. So antisepsis, I should start with that. So with antisepsis, the reason for antisepsis is really also another surgical reason. So, antisepsis was developed to understand how and why patients, at least in part, to understand how and why patients became infected after being incised with a scalpel. And they eventually, at some point, scientists eventually realized or found that it was due to microbes. They did some specific experiments where they put certain contents in a bottle and closed it and waited to see if anything kind of grew, and eventually were able to kind of isolate the bacteria. I don't know the exact scientist who gets credit for that. I'm pretty sure it's probably a German, but I just don't know which one. Maybe a German can comment on this video and put that name in there, because that would be really helpful. But that was helpful because that allowed doctors to start, and surgeons eventually, to start operating where they could, create a surgical field that was antiseptic and decrease and almost nullify the risk of getting an infection during a surgical procedure. So for surgery, antisepsis is very important, because if you're going to operate on someone where you're making a surgical wound via an incision into their skin and subcutaneous tissues and eventually down to an organ, or another organ rather, then we want antisepsis for that situation and that part of their body, so that we don't introduce microbes and put them at risk for tissue infections, deep tissue infections, superficial tissue infections, superficial skin infections, or sepsis. But for most people, sepsis is really never, or rather antisepsis is never really the goal. The goal is to be cleanly. And to be quite honest, for cleanliness, the simplest way to be clean, not joking, which just goes back to our evolutionary roots, that we came out of the ocean at some point, billions of years ago or whenever. Some anthropologists might know that, or an evolutionary biologist. But the point is, we can go right back into the ocean, into that salt water, and that actually cleans our body. And then afterwards, when you come out of the ocean, you can take a freshwater bath to clean off any excess salt. And that is clean. That is the easiest, probably, and the least expensive way to maintain a cleanly body. Beyond that, that is enough to get rid of any little dirt or any little, microbes that could be problematic and causative of some kind of infection. That's really the truth. But since have so much technology and all these people have invented all this crap, well, it's not crap, stuff that I like too, but all the stuff that's all over the earth, my God. we might as well use it too and learn how to use it. And, so soaps, mild soaps can be helpful. Very gentle soaps. So the harsh soaps do irritate the skin, and that goes beyond cleanliness. That goes to injury and destruction of one's body in a very subtle format, in a very subtle way. So even, just the mild soaps. For instance, I know that my mother, she tends to seem to go for antisepsis, wanting to use Clorox bleach on everything, exposing me to all these fumes, and, bleaching the hell out of all the wood and the walls, and, using other very toxic products. Most of that is almost never necessary for most people. And again, the exception that I know of is in surgery, where yes, we do use those things to clean out the operating theater and the operating room, and to clean the hospital floors, especially for the ones that the operating rooms are on. Because yes, any little microbe can colonize a particular wall or floor, and eventually can use its little villi or whatever to get through the patient, or even to the operator, and even to the anesthesiologist and nurses and anybody else in the room, and can cause an infection. But yeah, it's the patient who's at risk because of that open surgical wound. And so in that situation, antisepsis is very important. But, I just want to reiterate for everyone, yes, cleanliness is as simple as using water and salt water, lukewarm water or hot water to wash your hands, to wash your body, to wash your face, to wash out your mouth. And, beyond that, once you get that down, you might want to use other things once in a while. Obviously there's toothpaste, a nice toothpaste that's gentle, or a little bit of soap that's gentle also. But you really don't need, and maybe a little bit of shampoo, although finding a nice shampoo is not so easy. Again, something that's gentle. I can think of a couple companies that are pretty good with that. Although I'm not really trying to market for all these companies, but it's a little bit easier for people who want to find these types of things. So the things that I know of that are usually gentle, although I haven't gone into all the details myself yet, would be like Johnson & Johnson, because I know they make a lot of shampoos for infants that are supposed to be gentle. There's a toothpaste called Tom's from Maine, I think, and that's probably the best toothpaste I've ever had or used. I actually learned about that from a girl in Michigan whose name is Julie. And, and as far as soaps go, I used to really like Dove. It's a pretty mild soap, and it's not too drying. It's a decent moisturizer. But to be quite honest, when I really want to take a break and I really want to just soak my body and I really want to clean, sometimes I'll do it in the tub, but I really still prefer to go to the beach. And if you're concerned about sun exposure, you can go to the beach early in the morning, just before sunrise, or rather Captiva, or you can go at night, just around sunset, or rather, more correctly, Saptiva. And those words you can find on Urban Dictionary through some of my links. So if you look through my videos, you can get those links. I'll try to put those links on this video too. All right, anyway, that summarizes clean. So just to summarize those points, clean is the goal. You don't want to be antiseptic, especially in your daily health. Antisepsis is important for surgeons and for surgical care of patients, especially during the operative period, as well as the post-operative period, and obviously the pre-operative period. So it's really pre-operative, operative, and post-operative. But having said that, for most people, barring the necessity of having a surgical procedure done on them, or having an incision, or even cutting themselves, that's another time when antisepsis is kind of important, but not as important as an operation, the goal still really is just to be clean. And do know a little bit of dirtiness is actually really helpful. Even mud baths, can be helpful. So don't be afraid to get dirty and know how to become clean.